Welcome to our group presentation on interprofessional healthcare teams. This presentation is brought to you by myself, Erin Callahan, Stracella Lespinese, Sharon Ricciuti, and Anne Winfrey. We are students at Brandman University. What is the purpose of interprofessional healthcare teams? Interprofessional collaboration involves two or more professions working together to achieve common goals and is often used as a means for solving a variety of problems and complex issues. Interprofessional collaboration allows participants to achieve more together than they would individually, serve a larger group of people, and grow on an individual and organizational level. Improving healthcare collaboration has been a key strategy for healthcare reform for years. Collaboration in healthcare has been shown to improve patient outcomes in many ways, such as when collaborating with pharmacists, it can help reduce preventable adverse drug reactions and optimize medication dosages. Also helps decreasing morbidity and mortality rates when working with other professions in the healthcare setting. Now we will discuss what the hallmarks and characteristics are of an effective interprofessional team. A successful team needs to have clear goals that everyone on the team can work towards. There needs to be clarity about each team member's role and contributions. Also, clear and open communication. There needs to be effective decision-making and engagement of all members in the work of the team. There needs to be an appreciation of diversity. And what that means is diversity in generation. We have millennials working with older generations, working with Generation Z. These different generations have different ways of looking at problems and solutions. And so we need to welcome that difference in the generations. We also need to appreciate the diversity of culture, having people coming from different cultures that could actually help with patient care coming from a different understanding and a different viewpoint. Also, diversity in thinking. We need to have different ideas to form a successful team. Also, trust among members. Once you have that trust among your members, then you can start to build effective and cooperative relationships, and then you'll be able to manage conflict a lot easier when you have that trust and established relationship, because you all know that you're working towards the good of the patient. And there needs to be participative leadership as well.
Thank you, Erin. My name is Sharon Ricciuti. I'd like to talk with you about competencies team members need to possess to be effective participants. Regardless of the task, teams must be able to collaborate to be effective. In order to collaborate, respect for others on the team is essential. Members of the team must also trust one another. When a member on the team is asked to act on behalf of others on the team, that team member must be able to be counted on to carry out the task. This is interdependence. Objective, evidence-based criteria, when used by the team, can also help individuals remove emotion in decision-making. Good communication across team members is essential. Finally, effective teams need to be able to anticipate conflict and be prepared to manage it. The competencies of team participants are put to the test when they must collaborate to reach an outcome or decision. Collaboration generally requires three key skills: consideration of all sides of a dispute, agreement on the criteria for resolution of a given issue, and negotiation of solutions which all participants can agree to and find acceptable. Knowing, trusting, and being aware of the values of team members can facilitate the process of collaboration. Further, the healthcare environment is both complicated and complex. Successfully navigating the system on behalf of one's patients may come with expected and unexpected challenges. Such situations may require the collaboration to occur across teams, not just among a single team. For example, a team of individuals participating in the primary health care of a given patient may need to collaborate with one or more specialty teams. A team also requires skilled leadership. A leader serves to orient, develop, and coach the team to achieve high levels of patient-centered care. The leader is required to orient each team member of their role and responsibility as a team member. The leader is also responsible for developing the team through coaching. Coaching requires gathering objective information about performance, providing feedback, and evaluation. Coaching is required for individuals on the team as well as for the team as an integrated unit. Effective teams also face barriers. There are 4 broad categories of barriers to effective teamwork. The first pertains to relational barriers. Relational barriers tend to occur when there is lack of clarity regarding individual roles and responsibilities among team members. The second category pertains to process barriers. Such barriers relate to the work itself. Perhaps disagreements on guidelines or diagnoses and treatment can contribute to procedural barriers. The third pertains to organizational barriers, which refers to goal misalignment. This can occur when the patient's goals are not front and center of the team's focus. And the fourth applies to contextual barriers. Contextual barriers refer to expectations or perceptions of one's role in an organization or society. This might be common in situations when the physician is perceived to be the leader of the team, but another individual is acting in that role. All of these barriers have a theme pertaining to communication. Lack of communication regarding roles or responsibilities can contribute to barriers to a team's effectiveness. Next, I'd like to turn the discussion over to my classmate to discuss conflict.
Learning about professions is a first step towards collaboration. If team members do not learn about each other, conflict can occur. Many professionals are remarkably ignorant of the healthcare professions due to a lack of collaboration during their respective education. In the course of their training, many providers have a tendency to become socialized into their own professions and subsequently develop negative bias and naive perception of the role of other members of the healthcare team. When these negative biases or naive perceptions occur, there can be conflict. You see, it's not always possible to get along with every team member, but how those differences in opinions are handled is what truly matters. When conflict occurs, it can be related to disrespect due to the level of authority, power, or expertise. Conflict can occur due to role and leadership ambiguity. Conflicts can also occur because of lack of training and interprofessional collaboration, as I previously mentioned. Sometimes teams are developed too small or too large, which also creates a conflict. There can also be a lack of the appropriate process for timely exchange of information or how problems are discovered and resolved. There can also be a lack of clearly defined team goals. And poor goals can then lead to lack of commitment of the team members, leading to apathy and also poor accountability. Each person is only as good as the people they are surrounded by. This is true of interprofessional collaborative teams. When different professionals are brought together, it is not uncommon for conflict to occur. Despite these disagreements, it is important for each team member to move past their differences and focus on the common goal. You see, team diversity should be viewed as a strength. It can bring about different viewpoints, facilitate innovation and problem solving, and have the potential to result in amazing outcomes. The key is for each team member to work towards a common goal and have a shared vision on how to achieve that goal. In order to avoid conflicts within teams, it's helpful to develop a commitment to the common goal of collaboration. It's also helpful to understand the role and expertise of other professionals within the team. Conflicts can be avoided by respecting others' skills and knowledge, and also by developing trust between each team member. Conflicts can be avoided by having a shared responsibility and establishing a mechanism for negotiation and renegotiation of goals and roles over time. Establishing a method for resolving conflict between team members is very helpful to improve the cohesiveness and to be able to maximize the outcomes. Lastly, conflicts can be avoided by having a willingness to work continuously on overcoming team barriers. Interprofessional collaborative teams that are efficient at producing quality outcomes are also teams that are efficient and effective with conflict resolution. Some of the strategies to resolve conflict resolution includes developing a protocol and reliance on leadership for conflict resolution through negotiation, providing open and direct communication that helps encourage communication among the different team members, clarifying roles in order to maintain relationship and preserve the professionalism among team members, fostering mutual respect and trust is also a very important goal to help resolve conflict. Providing listening and response to each team member. Taking the time to listen allows each team member to recognize that they are important and that they are heard. Lastly, practicing humility by acknowledging fault. By acknowledging fault through being transparent, setting a precedent for each group member to know that things will be honest and fair, and that if we make a mistake, it's okay. No one's perfect. Challenges require every member to remain committed to the ultimate goal. This is in the case for all healthcare. Since adversity is something that every team is going to have, it is very important that healthcare providers work collaboratively to become effective at dealing with any challenges that they may have.
Hello everyone, my name is Anne Winfrey and I'll be presenting the most effective conflict management methods with interprofessional teams and our team dynamics, which is broken into two parts, the team's strengths and weaknesses. There are 5 major methods for conflict management according to Dominguez and his colleagues, measured on two dimensions. One is assertiveness and the other is cooperation. Assertiveness is the length one would go to satisfy his or her own concerns, while cooperation is how far one would go to satisfy other people's concerns. There are 5 major methods, and that includes avoiding, compromising, accommodating, competing, and collaboration. So avoiding is neither assertive nor cooperative. Compromising, on the other hand, happens when parties get to a deadlock and decide to reach a temporary settlement for the benefit of the patient that's been taken care of. This is the middle ground of both dimensions. Accommodating is more cooperative and there's no assertion. Competing, on the other hand, is more assertive and there's no cooperation. Collaboration, which is both assertive and cooperative, is what is preferred. So the 2003 IOM report described 4 key processes necessary for an effective interprofessional team, and those include communication, cooperation, coordination, and of course collaboration. The hallmark of a collaborative interprofessional team is its ability and willingness to resolve interprofessional conflicts, which we know is unavoidable because teams are more diverse these days, dispersed, digitalized, and very dynamic. The success of interprofessional teams lie on the core set of fundamentals for group collaboration. Brown and his colleagues in the article titled Conflict on Interprofessional Primary Health Teams give us 2 fundamental ways of resolving conflicts, which has been discussed earlier by my team members. So I'm going to be talking about team dynamics. So some of our strengths include having mutual respect for each other, efficient communication through email, text messages, and phone calls. Every member of the team had a clear role. Work was divided evenly. We had some good time management. Each member worked well independently and together. Some of our weaknesses included time constraints. I had some technical difficulties with recording, working with different time work schedules and shifts. So coming to conclusion, interprofessional teams are essential for working in a complex healthcare environment, as we already know. Some of the requirements for these include effective individual members and leadership, having a shared goal. Overall, our team functioned well. Some of the keys to our success included focus on our shared goals, learning to trust each other, collaborate, and of course stop compromising was done as well.
We would now like to invite you to please review and enjoy our references. Thank you so much for listening to our presentation.